I'll take it away. Hold on. Now leave it. It takes more time to shave.
Clear problem.
So it's
Here.哎呀，痛死我了，好痛啊！ You
Feels
mean
good?
it's good? I can't feel my mouth.
Yeah.
Let's see. In Chinese, it's a mamu.
Let me take this out. It's beautiful. Yeah, it's very beautiful. And this is only 4 days. It's going to get better. Okay, because you know what? This will go more in. I also do little work on your muscle.
Yeah.
You know you have the muscle?
Yeah, on myself.
I do a little trimming inside
Yeah.
the muscle.
Yeah, doctor, I wanna ask you because you know, I'm the important first thing. I want my one side go inside. Before we discuss, I think we want to talk about cut bone and maybe you tell me one or more, maybe one or two go inside.
Implants.
Go cut and implants.
Mm.
Yeah. And in the surgery, you change your mind, you change plan,
Not in the surgery, even before we change, because your chin was protruding, and if you make a cut and take it back, then you get some loose tissue here like this. You look old. So I just nicely contour it, create a new chin for you without putting implant. And this is more difficult because we have to do a full extent of jaw sculpting, and also we have to do genioplasty. And in order to get this definite shape, genioplasty. No, I don't put any implant. No. Genioplasty doesn't mean putting implants. Genioplasty means changing the shape of the chin. Geniumplasty. Genium is chin. Plasty, changing the shape. So we can change the shape in many ways. We have 15, 20 different types of cuts we can do without making cuts. Many ways we can change based on what's best for the patient. Okay, because for you, your teeth are already compensated. Your teeth are in this direction, your lower teeth. So that's why this was a good plan for you.
So I know that because
Tell me if you're having pain.
What pain?
Any pain?
And now?
Yes.
A little bit, it's okay. And now today I already can see fish.
Yes.
It's difficult, fish can mushroom.
You eat fish, mushroom, what else?
Noodles. Yeah.
You're eating everything.
Yeah, now so
And you did major jaw surgery.
yeah, because I see another patient, he cut bone, maybe he how to say get better is slowly.
No.
No?
We bring with that girl in 3 days, she's better. Also.
Oh yeah, right.
What is the level on that?
Yeah,
So what you want to show me now?
I wanna show
Noodles?
mushroom.
Mushroom? I'm hungry,
So the first, after surgery, after 7 days, we take this or not.
No.
But in my country, after the jaw and hand surgery, must take the total.
We can
Yeah.
give you one if you want, but I don't put for most of my patients.
Yeah.
Because I still put the muscle inside and tighten it.
So I just want, because you are professional, just different country, different culture, different the ideas. So this is better or not?
It's good. You can put if you want. No problem with that. Only thing it's difficult to wear it every day.
Yeah.
But you can wear it for 7 days or 2 weeks. You can wear, not for 4 months. not 4 weeks.
This where it's is better or not?
Yes, you can wear it. It's no difference. The way if you wear it or no, it's no problem. But you can wear it.
Oh yeah. So you have this.
Yes, we have to make it. We don't have ready-made.
Oh, you can make it.
We can make it you.
Yeah. Okay. Because I don't know. Oh, I wear or not. I don't know. Yeah. Just see. And another. Yeah. Shaving the bone. Yeah. You shaving my bone?
No, not there. This is not the surgery for you. This is a shaving in the back. No, no.
Not here.
I don't do there. I do here, everywhere.
Oh, here. Yeah.
This is not that surgery.
Oh, yeah. I just mean they shave the outside.
This is not shaving. This is removing. See, they remove the bone.
Yeah.
No, I didn't do that for you.
Oh, yeah.
No.
Just shaving here.
Yes.
Yeah.
Yes.
Oh.
There are many techniques we can do, you know.
Yes.
Many techniques are there. As we learn to manage patients, you know, like even the literature in genioplasty, I think there are more than 20 techniques published. There is the propeller genioplasty, asymmetric sliding genioplasty. Today we did a genioplasty, very different. We moved the chin from here to here. For you, the chin was long, we move it from here to here, like this. So different patient, we can do different techniques.
Yes.
That's the difficult thing. To know which technique to do for which patient needs experience.
Yeah.
That needs experience.
Yeah, needs experience.
Because I've done thousands of patients and I have exposure and training that I can suggest the best for you. And sometimes I make decisions on the table. Everything we plan, but it's like an artist. You know, when he's prepared with the canvas and everything, but finally you say, no, maybe I need to make some changes, and you should do it because surgery is like that. It can never be 100% as you plan. But if you don't plan, then you definitely fail. That's a different story. But even after a lot of planning, you must be able to change the plan a little bit, depending on what you find for the patient.
So in your surgery, have something the plan maybe
Change a little bit. But today's patient, I don't change anything exactly according to the plan. But in some other patients, in your case we change because you also put silicone. In my original, I want to put drill. But because you tell me I don't want a scar there and I'm doing yoga, I'm wearing bikini, I'm like, okay, and I see that they put the breast implants for you through an areolar incision. That's why I decided against it. So this is because I don't want you to get a scar there.
Yeah.
It's better I put a material that doesn't last so long, but no problem. Even if the silicone, let's say, is not doing well or you need to remove it, after 10 years, your lip shape is not going to change. It's going to be like this for life. Because I fix the muscles, everything, and they stay after 4 weeks like that. So it's not a problem.
Okay. So the last, everything is okay? Yeah.
So we have to wait for the healing to come down, and you can take bath, and tomorrow clean up. And when are you leaving? Day after tomorrow?
Friday, yeah.
Day after tomorrow. Today is Wednesday.
Friday.
Perfect.
Yeah.
Friday will be good.
Yeah. Maybe I see everything after 1 month, 1 month, 1 or 2
1 month is going to be good.
Yeah.
After 3 months, very, very good.
Oh, yeah. Okay. Depends on the good.
Well, it's 4 months. 4 days is very good.
You know, for patient like that, the first thing you must tell the patient, every surgery maybe depends on your experience, technology, and maybe in surgery change.
Yeah.
Because in my country, because I trust you, so I don't see anything. I just say 3 months ago, I trust you. But like this program in my country is different. Even if I take you, go to my country for surgery.
I don't come there.
I just say because Korea or lots of Korea surgery.
China?
Yeah, doctor.
Okay.
哇靠，那个手术费 cost how much, you know?
Okay, how
yeah. If a very good Korean
Doctor?
Doctor who have more than 10 lakh, more than 10 lakh.
More than 10 lakh rupees? Wow.
10 lakh, yeah, like clothes, like chain, more than. But how to say? Must Chinese trust them. Trust them. Chinese trust another country, especially Korean like that. Yeah, doctor depends on technology. But lots of things like that. We make the choice and plan. Yeah. If I don't tell you, maybe can be changed, and after I know that, why you change? Oh my God! If you make better, it's okay. But if they can't, they can't feel good, feel better. Wow, that's bad, That's,
No, but whatever you may say, we make up generally because these are complicated surgeries. If you're doing only rhinoplasty, it's different. Then we say, okay, we need to take a rib for you. There's no big change in the plan. But when you're doing major jaw surgeries, I have seen it tends to happen. And you should be able to do that to get over the problem. I had an instance once, not long ago. So I was doing an osteotomy and for some reason it breaks wrong.
A bruise wrong.
Can happen. Any experienced surgeon can have a day where the osteotomy goes wrong. What do you do then? According to the textbook, they say just put it back, close, come out. After 6 months, do surgery for the patient. But no, I manage. I do another technique to get over this problem. Because it's possible if you know the anatomy and if you think that many times it's possible. And when you're doing complicated surgeries, especially during my training, I have learned that if one thing that you're planning doesn't work, you mustn't panic, but you must think, okay, what's the next thing that you can do in order to get the patient a better result? Because, surgery can happen. It's like the pilot, he planes the plane in a normal way, but in case of some tailwind or whatever, they have to have another plan. You cannot say one plan or no surgery. In a simple surgery, yes. So that's why it happens. And I've seen that most of the times it goes well. It goes well because you have the experience and you've done so many cases and you know the results. So it goes well. And in your case also, it's gone very well. You're going to be very happy in the next few months. You're already looking nice. I'm sure you'll be happy. And then you're probably going to tell me, good job, yeah? No? You better say that because it's going to be good. It's already nice. We're going to see you again tomorrow. But you can take bath now. And what about IV line? You stopped it? We can start. They stopped your IV line, no, right?
Not yet.
You will still continue till tomorrow. Your drugs?
Yeah. Tomorrow finish, yeah?
Yeah, we finish tomorrow.
Yeah, and after tomorrow
You leave.
I leave.
Perfect.
Yeah. So how about my nose? I want to ask. Yeah. I just.
So we wait for 6 months or 5 months like this. And then if you want a nose, then we can make a nice big nose with rib. I will harvest the rib, but there will be a small scar here at the inframandibular region, very tiny. We can take a nice way to do with the rib and remove your what you have now, silicone, right? You have what? Bedport, Gore-Tex.
I don't know.
Okay, it feels like silicone to me. Whatever it is, we will remove it and then we can put the.
I make a silicone and I take the fat here and do this because this I'm very shorter and weak.
Okay.
Like that. So before my nose must take if one natural, I think natural and maybe longer, take rib and maybe a little bit fat here.
Or it's also called dermal grafting. We won't do that. I'll only need your rib.
You don't want to.
I don't need fat. Only rib is enough.
Only rib enough?
Yes, enough.
But it's strong.
Yes.
For here because I do two.
I put different grafts. So we put one graft there, dorsum, and then we build it up with a septal extension graft, with spreader grafts, with marginal rib grafts like that. It's not just one bone.
Okay.
It's going to be like a bone that comes from here,
Yeah.
side, there, everywhere. It's not just one bone.
Like that.
Yeah. It's more difficult than just putting fat, but it's better.
Put fat is difficult.
It's easy.
It's easy,
Yeah, it's easy. You just take fat and put it in the tip.
Yeah.
But this is, you have to cut the cartilage and put it according to the framework of the nose. So it takes a little bit more time and a little bit more skill.
Yeah.
But we can do that, not an issue. So we did that for this guy today. The same thing. This patient, today we did the same thing.
Oh, that's guy, yeah?
Yeah.
But his nose is big.
Yeah.
Why he do?
He wants this to become small
Oh.
and this to become big.
Oh, he's actor? No.
He's not an actor. He's a businessman.
Oh, businessman.
He's in Dubai, so he just wants to have a good nose.
I think in India not so people. In India not so people like build face. Yeah.
Beautiful face.
Yeah. The first time I
The
know.
first time is me, you told me.
Yeah. It's more than I imagine. Yeah.
Really?
What in my country, lots of girl, lady, do lots of community. Yes, already how to say, development. Yeah, like Korean and Japanese in my country. Yeah, but for Indian, it's how to say. Most people need that, want that. Like everybody want have a Bollywood. Do you know Bollywood? Hollywood, like a Hollywood dream, like that. Want to become superstar, become beautiful.
Okay.
Like, yeah. So
here in India we like Bollywood.
yeah, like a Bollywood. So I think let your brand bigger.
Bigger? Okay.
Good. That's yeah.
Thank you.
In 5 years or 10 years, maybe you can get the rich, so rich people. Yes, because India is a so big market.
Don't worry, I'm already rich. No, it's okay. Money is not the main thing, but I understand your point.
Yeah, you can understand.
Yeah, I know.
Yeah. Because you can depends your experience. Let the experience become better and help another person help. That's very important help.
So I will see you in the morning also.
Okay.
Okay, then we take some nice pictures.
Okay.